So peeling skin is normal in babies. It is a question or concern that comes up a lot, and it's actually normal. So if you think about it, baby is used to just being in liquid, right? So when they come out, it's really dry out here. It's not the same as what they're used to. So their skin can be dry too. So that is very common. Normally their hands and feet will peel a lot, and that is okay. It's not harmful to them. It's just kind of their skin is getting used to being in this different environment. Usually around a month of age, this will stop. So typically it's just kind of that first month we'll notice the peeling more. If you want to use a lotion on your baby, that is okay and safe to use. I think the best one most of the time is just like a Vaseline or Aquaphor, because it doesn't have a lot of any scents or additives in it that can cause kind of irritation in baby's skin, because they can be really sensitive. And so that's just an easy one to just have on hand and to use if they seem dry. When you bring baby home from the hospital, you really don't need to bathe them a lot. Once a week or so is okay in that first newborn period, because their skin does dry out easier and they actually do better without having those frequent baths. And they're also not getting dirty. In the beginning, they're not, eating and getting food all over them and things like that. So it is okay to just do about a weekly bath in that time. So cradle cap is a common finding that babies can get. It basically is just, if you look at their head, they have just kind of this like yellow, almost like a little kind of crusty area, but sometimes it can look a little bit oily too. So it's very normal in babies, and it happens quite a bit. Usually with age, it will just go away. But if it is becoming a lot or it's kind of bothering you, some easy things to do are you can actually just get like an oil, like if you have at home, like an olive oil or a coconut oil, and just kind of rub that on their head, and then get a fine-tooth comb and just gently kind of brush those scales out. And they probably will come back in the beginning. They kind of just recur, but that is something you can do to prevent it from being too much. And then with time, if your baby is, getting older and you're still noticing this, say they're like 6 months old, 8 months old, and you're like, oh, that's still there and it doesn't seem to be getting better, there are shampoos, prescription shampoos that your doctor can prescribe to help with that. But usually we try to avoid those in the beginning, just because it is not a harmful condition for baby. And the shampoo itself can cause like kind of burning in their eyes. So usually something that we just kind of try to manage symptomatically, unless it isn't getting better with time or it's getting a lot worse.